Hi, I'm Lusager and I'm doing my topic on the carpal tunnel syndrome. So the carpal tunnel is a narrow passageway in the wrist that is about an inch wide, and the floor of the tunnel is made up of the carpal bones, which are the hamate, the capitate, the trapezoid, and the trapezium. And the roof of it is made up of the flexor retinaculum or the transverse carpal ligament. Since these boundaries are very rigid, the carpal tunnel is not really able to increase in size a lot. And there are also 9 tendons that bend the finger and thumb that also travel through the carpal tunnel. These tendons are the flexor digitorum superficialis tendons, and flexor digitorum profundus tendons, and a flexor pollicis longus tendon. So the carpal tunnel syndrome occurs when the tunnel becomes narrowed or when tissues surrounding the flexor tendons that I just mentioned swell and put pressure on the median nerve. So these tissues are called the synovium. Normally the synovium will help you move your fingers easier by lubricating these tendons, but when it swells over time, it will take up space and it will overcrowd the nerve, which will put pressure on the nerve, resulting in pain, numbness, tingling, and weakness in the hand. But also there are other risk factors for carpal tunnel syndrome that occur, one of which is hereditary. Some people have anatomical differences in their hand which will change the amount of space for the nerve, and these traits can run in families. And also repeating the same hand motions over a prolonged period of time that will aggravate the tendons, that will cause swelling and put pressure on the nerve. And also pregnancies, there are some hormonal changes during pregnancies that can cause swelling. And if you have health conditions like diabetes, arthritis, or a thyroid gland imbalance, these are all the conditions that are associated with the carpal tunnel syndrome. So the median nerve innervates the thumb, the index finger, the middle finger, and the half of the ring finger. So these are the areas that are associated with numbness, tingling, burning, and pain. You can experience occasional shock-like sensations, and you can also have pain or tingling going up your forearm and arm. And you can also have weakness in the hand, which will enable you to hold on to things or do easy things like buttoning up your clothes. So these symptoms usually begin gradually, but over time they get worse, and this is when people notice these symptoms. So as for diagnosing, you can have a physical examination, which the physician will press down the median nerve and inside your wrist to see if it causes any numbness or tingling, or he can do that by bending and holding your wrist in a flexed position as well. And he can test the sensitivity in your fingertips by lightly touching them with an instrument while your eyes are closed. Or you can have certain tests done. Like this right here is an electromyogram, which will measure the electrical activity in your muscles. It will help you show whether or not you have any nerve or muscle damage. But there are also ways that you can have ultrasounds, and x-rays, and MRIs, which can all help diagnose the carpal tunnel syndrome. So as for treatments, there are certain exercises that you can do, like wrist stretches and tendon glides, or grip strengthening, and you can have wrist flexion or extension exercises. And you can also have bracing. You can wear it while you sleep or during the day to keep it in a neutral position that will decrease the pressure. Also, you could use medications like ibuprofen that will help you relieve the pain and inflammation. Or you can adjust your daily activities where if you do the same positions for too long, that will keep your wrist like overly extended or flexed. You can make adjustments to those. Or you can have steroid injections, like right here, where you can use corticosteroid or cortisone, which will help reduce the inflammation, but sometimes this treatment is only temporary. And whenever these non-surgical treatments do not work, there's also surgery, which is called carpal tunnel release, which you can do by two ways. This one right here is an open carpal tunnel release, where your doctor will make a small incision, and during the procedure, he will divide the carpal tunnel ligament, which will increase the size of a tunnel, and it will decrease the pressure on your median nerve. And this one right here is a endoscopic carpal tunnel release. And this one, he will make a small incision, and it will use an endoscope with a camera on it, and he will use a cutting tool, like shown in the picture, and he will divide the transverse carpal ligament just like the open carpal tunnel release. And as for recovery after surgery, you will have some pain and swelling and stiffness, but people usually recover by 2 to 3 months after the surgery. You will gain your strength. But if your median nerve was in a poor condition before the surgery, the recovery time may take longer. But for most patients, surgery will improve the symptoms of carpal tunnel, even though recovery time could be longer for some. And the carpal tunnel can reoccur, but this is very rare for most people. Thank you for watching.